Hi guys. So I know I just posted a video yesterday for my 2 week update, and it turns out I got the day off of work today. Uh, so I decided that I should make my video about what happened in the hospital and right after surgery that I couldn't talk about because I couldn't talk that well. Um, so I'll just start off. The day before the surgery, I posted a video talking about how my parents took me out to dinner and told me that I had the option to do both bottom jaw surgery and top jaw surgery, which they weren't okay with me doing that at first, and that's why I thought I was only going to do the bottom jaw. And so that night I came home and I talked to my doctor. I called him on his cell phone, and he told me that I had until the next day, until I got into the hospital, to decide what I wanted to do. And he had plans for either surgery, if I wanted to do just the bottom or both top and bottom. I didn't decide what I was gonna do until like 5 minutes before they wheeled me into the room to do the surgery. I was laying in the bed and they were getting all of my IVs in my arms and stuff like that. And I talked to the doctor with my parents, and right before they gave me all the medicine to knock me out, I decided, I was like, yep, let's do both. Um, it ended up just being doing both top and bottom jaw surgery would give me the fullest results that I could get. Whereas if I just did the bottom jaw surgery, it would fix my bite, and my bite problem that I had. It would have made it so my bite came together perfectly, but my smile, it still wouldn't have been all it could have been if I had just done the bottom jaw surgery. So I decided, let's do it all, because I don't want to live with any regrets in my life, and I feel like if I had only done my bottom jaw, that would have been one of my regrets that I had to live with forever, because I would not be doing the surgery a second time just because he would have done the jaw surgery for my bottom jaw, and if they did the top jaw later in my life, it would have overcompensated and my bite would have been changed all again, and it would have just made for a lot more difficulty. So I got lucky enough. I'm still 17 years old for a couple more months, so I could go into the children's unit of the hospital, which was the best thing ever. It was so amazing. I'm so happy I got to do that, because all the nurses in that unit are they're working with children all day, so they're cheery and right there and ready to help and want to make you comfortable. And that was the best thing that I could have had done, and I loved everybody in that unit because they were all just so amazing. So I am so grateful that I was still underage. Because if not, I would have gone into the regular part of the hospital. And those nurses there are great too, but these ones were just especially great. I just feel like they went out of their way all the time to be right there and help me. Um, so yeah, they gave me my medicine. That it didn't put me to sleep yet. It made me really loopy. I don't really remember anything after they gave that to me, but apparently I was awake and talking. I don't know what I said, so hopefully I was kind. Um, I just remember actually being wheeled into the room where they were going to operate on me, and I was laying down in the bed and looking up, and all I remember is seeing big lights, and they said, okay, here, we're going to give you some oxygen, and then I don't remember anything. I said in one of my previous videos that I was saying to the doctor, "Are you sure you don't want to wire my mouth shut because I might talk when I come out?" And he said, no, you'll be pretty drugged up and you'll be tired and stuff. Well, I was right. I fooled him. I came out talking away. I think one of the most annoying things about the surgery was blood pooled in the back of my throat. All through the night, I woke up probably every 45 minutes to every hour because the blood pools in the back of your throat, and because I had the breathing tube down my nose and down my throat during the surgery, when they pulled it out, my throat was swollen, so you can't swallow anything. So you have to, well, I had to cough up the blood and spit it in this like suction thing like they use at the dentist. That was awful. It was really annoying. It bothered me so much because no matter how much you cough it up, you still feel some sitting back there. And because I got the double jaw surgery, they had to cut into my sinuses, and when they did that, it makes like a mucus come out, like as if you have allergies, and so you feel that in the back of your throat too, and it's just not fun. I didn't like that. I was pretty miserable about that, but I tried to drink water out of a syringe in the hospital, and they said people don't usually do that. Maybe you shouldn't be doing that, but I was determined because I was so uncomfortable, and I did a little, but it wasn't easy. So I only stayed in the hospital for a day. They were going to keep me longer because during the surgery I lost a lot of blood. They were doing tests on me that night right after the surgery to see how my like blood count was of my white blood cells and everything, and I wasn't doing very good. Everything was pretty low. And the next morning they tested me again and I was doing better, so they let me go home. I heard in other people's videos that their hospital stay wasn't very fun because they had to get up every 5 minutes to go to the bathroom, but they gave me a catheter, so, which was great because I didn't have to get up until I had to leave. So then I came home, and coming home was, it was alright. It wasn't very fun because I don't have a bed that inclines or anything, so I had to stack a bunch of pillows behind me, and I slept in my mom's bed with her. That way I had somebody to help me if I needed help in the middle of the night. I think the most difficult thing was probably not even like the pain from it, but the trying to relearn how to swallow any liquids or my medicine. All my medicine was liquid. My pain medicine, my antibiotics, everything was liquid. And since my throat was swollen, I couldn't really swallow that well, so most of the stuff I ended up spitting up. That was a big pain. And another thing was just all the blood that kept pooling in the back of my throat was really annoying. I think probably one of my biggest saviors was my little like baby like booger sucker thing was like the best because I have two. I used one for my nose because my nose will randomly just start bleeding, and it still does that, but it's not very bad anymore. And then I had another for my mouth, and I'd suck out all the blood that was in my throat. Other than that, I'm pretty happy with my results so far. Like I said though the other day, like I am still really puffy in my face. Like you can see it all right here. And I've got it on my top lip, and over here it's still pretty puffy too. But like seeing the difference in my like how my teeth like overlap each other, it's so cool. And like how my lips are even now, this like size wise, and when you look at me from the side, how they just look proportionate to each other. I'm very pleased so far with my results for everything. I hope that everything that I'm saying, all these little things that bothered me, like, oh, my breath stink really bad, and the blood in the back of my throat, I hope those things don't make anybody else change their decision of what they're doing, because so far I'm not even, I'm barely in my third week 3rd week, and I am pleased, you know. So don't let the little things that can be a little bit irritating change your decision, because the things that you're going to end up loving so about the surgery are like going to outweigh the bad things so much, because they have so far. For me, like, I am just really pleased, and my biggest thing is I can't wait to be able to have a sandwich and be able to bite all the way through it without pulling all like the meat out of the middle. I had that. I'm just so excited to do that. But I'm still eating mushy foods for now, so we'll have to wait and see when that happens. If there's anything that anybody wants to know or hear me talk about, I'm usually regularly checking this YouTube channel, so ask me anything and I'll let you guys know. I'll write you guys back, or if you need me to make a video or something, I will make a video. So thank you guys for watching, and I'll be making an update at my 3 weeks, probably on 3 or 4 weeks, to say anything new that's going on. So I will show you guys my bite and the sides of my face like I always do. So here's my bite. And my smile, not good. I don't like to do it. And here is the sides of my face. So here's one side, and here is the other. Okay, so thank you guys all for watching my videos.